press down. Then after that, once they relax, I'll actually place my hand and I'll lift up the foot, and I'll see, it's hard to see, but I'll see how much hyperextension, and I can compare it to both sides. So if you look at James, yeah, fairly equal, but often there can be asymmetry with regards to the hyperextension. Again, you'll get increased hyperextension with ACL injuries. Yeah. After that, of course, you want to see them flex, and you can get them all the way. Generally, the normal angle is approximately 140. Some people can get up to 145. It essentially depends on how big their thigh is, and you can measure that as well. So again, in full extension, essentially the swipe or the bulge test is just to pretty much massage from medial to lateral, yeah, and then massage all the fluid, and then you just swipe along the lateral side, and you'll see a bulge of fluid that will come out on the medial side, and that's the most sensitive way to test for an effusion. There are other ways. If they have a large effusion, then of course you can just milk down the fluid from the suprapatellar pouch and just press down on the patella, and that's the patella tap. But generally, just the bulge where you just swipe across and then swipe up, and you'll see the bulge here, and that's the most sensitive. Next, like I said, you can press down, do a patella grind test, see if they have any pain. You can palpate along the patella tendon, and if they have pain, it's either patella tendon, or sometimes they have the Hoffa's fat pad behind the patella tendon. Yeah, and actually you can tell when you flex up the knee and you palpate again, those that have, if they still have patella tendonitis, they'll still have tenderness in flexion when you palpate. So if I bend it up and then I'll palpate the patella tendon again, if they still have tenderness, that's patella tendonitis. But if the pain goes away, then it's usually Hoffa's fat pad. Yeah. Then of course people can get quads tendinopathy, and you can palpate at the top as well. Yeah. In terms of patella apprehension, generally you want to flex the knee to about 30 degrees, and then you just push the patella laterally, and you can see whether they feel that the kneecap is going to come out or not. Yeah. The other thing that I do with patella instability is actually in full extension. I will also do the same. I will just push the knee and see how much the patella moves laterally, and actually I should also feel a check rein, so it should actually stop, and then I will test it on the other side and ensure that there's symmetry. So the main thing is, if you're not sure, as long as there's symmetry, then you know that they should be okay. Yeah. And then of course the medial joint line, the medial collateral ligament, the lateral joint line, the lateral collateral ligament at the epicondyle going down to the fibular head. So you can always feel the fibular head here. Yeah. So after that, you flex the knee up to 90 degrees, palpate again, patella tendon, you can palpate the lateral joint line. So there's this sort of like a dip here. See that dip, and where that dip is where the beginning of the lateral joint line. And you just bring it around and you can actually feel. And again, if there's tenderness, that's very sensitive for a meniscus injury. Same with on the inside, and they always have it. They'll just say right here, yeah, or right there, and they'll say that's the most tender point. And then sometimes if you're not sure, I ask them one or two, which one is more painful? And if they say 2, then you know it's the joint line. Then, because sometimes it can be difficult to sort of cone down on where their sensitivity is. So again, the lateral collateral ligament at the epicondyle, which you can feel at the top, it runs straight down here to the fibular head, and the fibular head is just below the joint line here. Then after that, between the tibial tuberosity and the fibular head, there's another bump here. That is what we call Gerdy's tubercle, and that's where your ITB, and you can actually feel the ITB come down and attaches down to Gerdy's tubercle. So what people will get is either with ITB friction syndrome is either tenderness at Gerdy's tubercle, which is down here, or the lateral epicondyle here. And of course, if you need a cortisone shot, yeah, you can just give it either to the lateral epicondyle or to Gertie's tubercle there, and the pain pretty much goes, and then send them to James or Simon to get them going. Yeah. Then over on the medial side, maybe I'll use the other knee because it's easier to see with the camera. Okay, so again, the soft spot, you just feel the soft spot just medial to the Patella tendon. That's the medial joint line, and you just follow this. It's like a little crevice in between all the way around the back, and usually the place where they feel pain is just posteriorly here. That's the most common place, yeah, in the posteromedial meniscus in terms of